Hello everyone, I'm Dr. Yamina Hamid, MD Transfusion Medicine and PRP Specialist. I work at Zaaya Skin Hair and Laser Clinic, Aloha. Today I would like to discuss with you about vampire facial. Now, why the name vampire facial? It is a very most popular treatment procedure that has been popularized by Hollywood celebrities. It involves drawing one's own blood and injecting back into the face of the same person, and this makes the face look so bloody, hence the name vampire facial. Now, what is platelet-rich plasma, PRP, that the thing that is injected? So, platelet-rich plasma is something which is derived from the whole blood that is drawn from the client. The whole blood, when it's spun in a centrifuge, it is separated into three components. Red blood cells, packed red cells, which settles at the bottom, and a middle layer of buffy coat, which consists of white blood cells and platelets, and upper topmost layer which contains the plasma, which is the liquid part of the blood. So what we use for this cosmetology treatment is platelet-rich plasma, the plasma which has concentrated platelets. Ideally, the PRP should contain concentration of plasma, concentration of platelets 2 to 5 times than that is present in the whole blood. What all are the indications for platelet-rich plasma therapy? One is for skin rejuvenation. Skin rejuvenation includes facial rejuvenation, neck and hand rejuvenation. So it helps in the reduction of fine lines and wrinkles and improves the skin tone and overall texture of skin. It also helps to combat hyperpigmentation and also melasma. PRP therapy can also be used to treat scars like traumatic scars, acne scars, burn scars. It can also be used to treat stretch marks which develops post-pregnancy and also which occurs as a result of weight issues. And it is a very good choice of treatment to treat under eye dark circles. So what is the mechanism of action of vampire facial or platelet-rich plasma face therapy? The first point is that, as I said before, platelet-rich plasma contains 2 to 5 times more concentrated amount of platelets than present in the whole blood. So these platelets contains its alpha granules which secrete a lot of growth factors, namely epidermal growth factors, keratinocyte growth factor, fibroblast growth factor, like a lot of growth factors are there. These growth factors will stimulate the collagen production because it is the collagen which keeps on declining as we age. So PRP therapy is a very good choice for as an anti-aging treatment. Now, another mechanism by which PRP treatment helps is by creating controlled micro injuries on the surface of the skin. Because we do PRP therapy either by direct insulin syringe injections, point-to-point injections, or with the help of a derma pen, microneedling with the help of a derma pen. So by both these procedures, we create controlled micro injuries onto the surface of the skin, and this will also stimulate the healing process and stimulates the production of collagen. What is the benefit of a PRP therapy? The most important benefit is that we are using a thing which is our own blood, is autologous blood is used for this purpose. So there is no risk of allergic reaction at all, and there is no risk of any transmission of infectious agent. It's completely non-toxic. So that is one of the highlights of a PRP therapy. Now, who all are the ideal candidates for a PRP face therapy? One is, they should not be having any active infections on the site of injection. If at all they have a history of fever blisters or herpes simplex viral infection in the past, they should communicate the same with the consultant, because they would require a prophylactic antiviral therapy before the procedure. These people, those who have uncontrolled diabetes are not ideal candidates for a PRP face therapy. And those who are consume excessive alcohol or as a heavy smoker or those who have autoimmune disorders, immunodeficiency disorders and all these disorders can affect the reparative process or the healing process that is required after this treatment. Now, before the procedure, what all you have to make sure? You have to make sure that you do not consume alcohol just 3 days prior to the procedure. And you should avoid completely aspirin, drugs which affects the quality of the platelet, like aspirin and NSAIDs, painkillers, ideally 7 days before procedure. And on the day of procedure, make sure that you have a light snack and be hydrated, because this procedure involves drawing blood, so better be hydrated and take a light meal. Now, post procedure, aftercare, what just after the procedure, what to expect, that is what to you will see mild redness, sometimes bruising, and all these redness, swelling and all would subside in a matter of 5 days. Now, this is the expected side effect. Now, if you ask what is the risk of this procedure, less than 1% chance of local infection, but that is actually very rare, and we follow very strict sterile precautions which would reduce the chance of developing infection. And the risk of post inflammatory hyperpigmentation, that is normally seen after a few cosmetic procedure in certain skin types, that risk is also very minimal in case of a platelet-rich plasma therapy. So, as aftercare, you should make sure that you are not exposed to direct sunlight at least for the next 5 days or so. If at all you are exposed to sunlight, make sure that you apply liberal quantities of sunscreen on the face and also the exposed areas. And you have to make sure that at least for the next 3 days you are not consuming alcohol. It is better to avoid caffeine and green tea for the next 2 days, because these are anti-inflammatory, and post treatment there is an inflammatory process taking place, so you don't want things that suppresses anti-inflammation, suppresses the inflammation. Again, avoid drugs like NSAIDs for the next 7 days. And you should not take a hot water bath or sauna and all just post procedure, and avoid excessive exercises or any activities that cause perspiration, because all these can irritate your face. Is the procedure painful? That is the most likely doubt that people may have. The thing is that 30 to 45 minutes prior to the procedure, we apply a local anesthetic cream all over the face. But because it is injecting PRP onto the face, during that insulin syringe injection, just a mild pricking sensation may be felt, which is actually tolerable. And post insulin syringe point by point injection, we do microneedling. Microneedling is a relatively painless procedure because we use it is a micro needle needling is done with the help of a derma pen, and derma pen contains a motorized cartridges which has very thin needles, and that too the needles just prick and leave the skin. So the amount of time that the needles pierces the skin is very minimal, so the pain induced is very tolerable. Now, what is the result that you expect after a PRP face therapy? You can see a facial glow 7 to 10 days after this treatment, but that is not the exact effect that we expect. The true effect of a vampire facial occurs by the production of collagen, so that will take some time, that is about like 4 to 6 weeks time. So we advise the following as the frequency of treatment. If you are doing vampire facial as an anti-aging process for the reduction of fine lines and wrinkles and all, it would be ideal if you do a procedure monthly for at least 4 sessions. It is said that following such a regime, at the end of 6 months, there will be increase in the collagen production to about 400 times, which is actually very significant to have a young looking face, and for the correction of volume loss associated with aging. So I hope that I have covered almost all the most doubtful areas of this procedure, vampire facial. I hope you will find this procedure very interesting. For more interesting videos based on cosmetology and dermatology, do follow us. Thank you.
ഏവർക്കും Zaaya സ്കിൻ ഹെയർ ആൻഡ് ലേസർ ക്ലിനിക്കിന്റെ ക്രിസ്മസ് പുതുവത്സരാശംസകൾ.